Okay, we are live. We're doing it again.
We're doing it again.
Yeah, I've been looking forward to this.
Me
Uh,
too. We had a really good response with the last one, so I think it's nice that we're doing this.
yeah, absolutely. Yeah. So last time we did this, we said that we went pretty broad about just TMJ, posture, neck, ergonomics, lifestyle, and we said we would go a little bit deeper today. So we decided to talk about orthotics because I don't know about
Yes.
you, but that's something that there's a million questions on.
Yeah.
No one seems to know what's going on. Like people who are suffering. It's just it's actually confusing because even for myself, when I got into this, I would be asking my friends who are dentists a million questions. What is there an orthotic, an appliance, a night guard? Is that the same thing? Like, does
Sure.
an orthodontist do that, or does a dentist do that, or is the oral surgeon? Should you go to a neurosurgeon? There was so much confusion around this, so I'm hoping that you can help clear some of that up, and then I can give you some feedback from what I hear from people as well. So, when it comes to orthotic treatment, what should be considered? Like, what is it? What is an orthotic?
Sure. So an orthotic is very, very different from a night guard. All a night guard does, like your dentist can make you a night guard, you can get one over the counter at the drugstore, you can get a night guard on Amazon these days, right? So basically, all a night guard does is protect your teeth. That is it.
Got
It
it.
does not treat your muscles and it does not treat your jaw joints. An orthotic is quite different, and it's tricky because sometimes they can look similar. So it can be quite difficult to distinguish what the difference is unless you're really well versed in this, right?
Okay.
So there's a night guard that protects your teeth. An
Mhm.
orthotic protects your teeth and treats the muscles and the joints if and when it's made correctly. And that's
Mm.
the tricky part. And
Got
then there's the word splint that people throw out there. I don't even like to
right.
use that word because splint can mean night guard or it can mean a TMJ orthotic.
Mm.
So splint is kind of one of those that I don't even use. So
Got
an orthotic, the way I make them is I measure where the muscles are sitting at their correct resting length. This is the relaxed neutral position of these muscles of the head, neck, and jaw.
got it.
And I measure where the joints are decompressed. And then
Okay.
I take a measurement of that, sort of like a prescription that you would get when you go to the eye doctor,
Okay.
right? It's a very specific, unique prescription, but this
Right.
is for the alignment of the jaw. So we
Mhm.
get that prescription and we build it into an appliance that you wear in your mouth
Mhm.
that guides your jaw to that very specific position. And when the muscles are held in their relaxed position
Mhm.
and when the joints are decompressed for a significant amount of time, good things tend to happen. We typically see pain go down pretty drastically within a month, month and a half. And these orthotics, again, if made correctly and followed up with the proper hands-on therapy,
Okay.
they can be very, very powerful. I've seen today alone one, two, three patients come that are in the middle of treatment right now. But when they first saw me, their jaws were locked closed. This is disc displacement without reduction, and they were in
Okay.
a ton of pain.
Got it.
Um, 2 out of 3 are unlocked. The
Mm.
first one just got her orthotics today, but she's already opening more just from the initial therapy I did with her.
Mm. O
So, these can be very, very powerful if they're made correctly, and that is where orthotics get their bad names because people make a night guard or a splint and they call it an orthotic, and then it doesn't help or it makes the situation worse, and then
right.
people are like, "I hate orthotics," and it's like, "Well, yours wasn't made right."
Right,
So,
right.
yeah, so there's, and then there's dentists out there. There's different schools of thought on how to
Mhm.
treat TMD.
Okay.
And some are very against orthotics. They don't even wanna hear that word, and they think TMD can be treated with, like, stress relief, seeing a psychiatrist, and medication. And that's just not true for an alignment issue. It's
Right.
just not true. So, there's so many different, schools of thought on how to treat TMD. It can be super confusing if you're someone that's suffering. So, I hope this helps clear that up.
Yeah, so just so I can kinda rephrase that from my understanding, when someone's using the term an orthotic,
Mhm.
that means it's actually changing your bite. Or it's changing your jaw position. But
Yes.
the goal may be to realign the disc in the jaw. Would you still use the term orthotic if someone didn't have TMJ disorder and you were just trying to change the bite for some other reason? Is that still an orthotic technically, or is that different? Like Invisalign, for example, is changing.
Yeah, no.
That's
Invisalign moves your teeth.
right. Okay.
Right? Where an orthotic is about the alignment of this
Of the
So
jaw
it's
itself.
really about the relationship of this jawbone, the mandible,
Yes.
to
Yep.
the maxillary bones.
Okay.
And that relationship, when it's not correct, can
Mhm.
cause TMJ problems. So it's about that relationship.
Got it. And that connection, the only connection, physical connection point between the two is the TMJ. That's the joint that connects
Isn't that
the
interesting?
yeah.
Yeah.
So
Yeah,
there
and the
you go.
teeth, right? The way the teeth come together. So
Right.
when you wear an orthotic, people are like, "Well, an orthotic is gonna change my bite, and I don't want my bite changed," but the bite is probably what got you there in the first place. The
Right.
bite might have been your problem, and so if your bite changes through treatment, it's because your jaw is adapting to this better physiological position, but
Mm,
then you are left with the conundrum of how do we fix your bite, right? So
right.
it can be a tough thing. I try to minimize the risk of the bite changing. So I
Mhm.
do things a little differently than a lot of TMJ dentists who make orthotics the way I do. Instead of having my patients wear it 24/7, I have
Okay.
them take it out when they eat to help reset their bite.
Got it.
So I can get, it's like walking a line, right?
Right.
Like we want to treat the muscles and the joints. And if the bite is causing the issue, we have to get the bite out of the way for
Mm.
long enough for the muscles and joints to heal without change, and trying to minimize the
Right,
risk of
right.
the bite changing.
Yeah, yeah. I understand. So, I mean, basically, hold on, I have a model right here. So you're trying to actually, like you said, change the positioning of the teeth, which, or we should say the positioning of the jaw, because the jaw is where the teeth contact. It's where the TMJ contacts it as well. But you're saying you don't want to keep it in a different position for too long, because that is acting on the joint itself. So you try to find like a happy medium where you can change the position without creating pain. I mean,
Yeah.
like in my world, when you keep any type of tissue in a different position for an extended period of time, if it's not the right position, it can create irritation. So,
Definitely. It can create irritation, and again, a lot of my people don't want their bite to change, but
mhm,
sometimes it's inevitable. Like,
right.
it's kind of like the way the teeth come together. If you think of it like think you go okay, so let's take this as an example. You go to a hotel and the
Hmm.
door is jammed and you have to like kind of slam it to make it shut.
Yep.
Eventually, time after time of slamming it, the hinges are going to wear out.
Right.
So then you replace the hinges, but you didn't fix the actual problem. You still
Mm,
having to slam it, and then the hinges wear out again. So the hinges are sort of like the jaw joints, and the way the door fits in the door frame is like how the teeth come together,
got it.
right? So
Yeah.
one thing can cause another problem, and
Right.
if you don't address the bite issue, and I am really good at not addressing the bite issue if people don't want to.
Mhm.
I'm pretty good at it, at not changing the bite.
Right.
But is it the perfect fix? No. I mean,
Right.
ideally, you wanna change your bite, but that can be upwards of 50 or $60,000,
Wow.
right? So it's like, how much do you want to spend? So it's like, we don't always make the bite perfect, but
Okay.
my patients are, tied to wearing their orthotic at nighttime forever,
Mm,
right?
got
That's the ba it is a hard balance, and other TMJ dentists will always say, "You have to get phase 2 treatment to fix your bite."
it. Got
So, yeah, different ways to do it.
So now, when you said something earlier about a night guard, and how a night guard is not going to actually, fix with the TMJ positioning. So night guards more common for clenching, right? And
Mhm.
from my understanding, if you are a clencher and maybe you don't have a TMJ joint issue, your disc is fine, everything's fine in there, but you clench your teeth a lot. If you
Right.
put a night guard in, your teeth won't get worn down, right? You're going to protect your teeth. There's protection there. And from my understanding, it will kind of stretch or decompress the joint a little, because now your teeth can't make as deep of a bite.
Right.
So my experience with those people is that they still may clench on it though. So their
Oh, yeah, they'll
muscles
clench.
still will hurt a ton, but all they're doing is making sure that they don't grind down their teeth. And is that correct in your assessment?
Yeah, yeah, and a night guard too, the problem, is the way we're taught to make it in dental school, right? Is we take impressions of your teeth and we basically make the night guard to protect the teeth, but it doesn't change the relationship of these bones to this bone at all. It keeps that relationship the same.
Hmm.
And that's the problem. So now it's just giving you something to clench and grind against
Hmm.
with that relationship. And so for some people,
Yeah.
night guards can actually make things worse
Mm.
because they're putting force in that same relationship. And so I've seen multiple people that get a night guard and then suddenly, so they go from clicking and popping and some pain to their jaw locking closed. And
Right.
they're like, that never happened. It only happened after I got the night guard.
Mm.
And, I'm not saying go blame your dentist if this happened to you and you're
Yeah.
watching, because it is truly a lack of knowledge. We're not taught about this in dental school.
Got it. And so first, what if you have someone who comes in and says, I I have TMJ or I have jaw pain. It's just kind of like a throw all term a lot of people use. It just
I know.
means my face hurts here or up here as well. And you check their joints and their bite and the TMJ and everything's fine. But they just have a lot of pain. And once you start digging into the history, you're like, okay, this person is just clenching down on their teeth. It's all muscle pain from tightness, but nothing's going on in the joint so far. Your joints are fine. What would you do with someone like that?
So, orthotic one, or I do another therapy called DTR, disclusion time reduction therapy. So if they're a candidate for that, I offer them both and let them pick.
Got it. Yeah, I've seen. I just saw a post that you had on that recently, DTR. So what goes on with that?
Yeah. So for DTR, we are measuring relative bite force, and we're also measuring muscle activity at the same time when
Hmm.
you bite down and then when you move your jaw right and left. Because when we chew, we go right and left and up and down. We don't chew forward and back. So
Got it.
those movements are really important. And so with DTR, we then take all those measurements, we look at everything, and we make micro adjustments on the teeth. I'm talking removing microns of enamel. There's 1,000 microns in a millimeter. So it's barely anything. It's
Wow.
kind of like filing your nails. It's a light dusting, if you will. And what
Right.
it does is we balance the bite force, we remove the back teeth that are interfering when we chew. And
Mm,
by doing that, we can actually calm down the central nervous system, because the back
mm,
teeth have nerves, peripheral nerves that synapse directly in the central nervous system. Every other peripheral nerve has a stop off point before it gets there, but
mhm,
not the back teeth. So
mhm,
once we start adjusting the bite, we see people get a lot of relief from pain with DTR as well. So it's a different way to go about it, and we're building the therapy into the bite. That's what's cool. So you don't have to wear an orthotic. And we've noticed that as we do DTR, people
mm.
clench less and less. So my theory here is that we're clenching because we know we don't have a good bite and we're trying to find it. So we
Right.
clench, we try again in this position. We're clenching and grinding, but we're fighting hard tissue. Teeth, our teeth are harder than bone,
Mm,
right? So it's like we're not going to win. We're just going to crack teeth. So if once we start giving people their ideal bite, I've seen clenching go down. It's amazing. And I've had DTR done myself, and I'm not clenching at night anymore. I mean, that's huge.
wow.
Yeah,
That's
it's
amazing.
huge.
Yeah,
It's very exciting.
that's what everyone's looking for. That's
That's
the biggest question.
like, how do you stop clenching? It
Yeah,
is. And
that's the most common question.
it is. It is. And so the only way I've found so far is DTR. It really has minimized or stopped the clenching completely in many of my patients.
Wow, that's really fascinating. Yeah, I'm gonna definitely have to. We're gonna have to go deeper on that too one day.
We'll do a whole DTR session if you want.
Yeah, yeah. No, I do want to do that. What about appliances when it comes to trying to prevent clenching or decrease clenching?
Hmm.
Um, I've seen some appliances where you are just they don't change the positioning of your mandible at all, and then other ones will anteriorly shift you a little bit so you can't get as deep of a clench on the molars. Is that a good idea? Is that a bad idea? Like, what are your thoughts on those
It's
types of?
I mean, if I think it's fine if it does help you not clench as much and it's not causing your TMJ issues to flare in any other way, right? So it
Right.
depends on where it's bringing your jaw. There are also NTI type appliances, which is basically there's like a piece in the front so
Hmm.
that when you bite into it, only your front teeth can touch.
Mm,
And so the way it works is that as you try to clench, if you're asleep and you're wearing this appliance, when your front teeth start clenching hard on that appliance,
mhm.
it provokes pain. The front
Yeah,
teeth are small. It hurts, right?
that's
And
yeah,
then as soon as it hurts, you kind of let go.
right.
So, but those come with a whole other host of issues too, right? So I have never made an NTI. I don't like them.
I've heard that those are something kind of the past that that was like popular a couple decades ago, right? Like
Yes.
NTIs.
Yeah, definitely like at least 15, 20 years ago. But I still see them being made.
Yeah. Yeah, when it comes to clenchers from that come to me, What I'm looking for strategies to decrease clenching. And so just natural, because we know that clenching also is part of the nervous system as well.
Yeah.
And so a couple different things that I usually look for with that. First of all, I just want to see if it's just a habit that they haven't gotten on top of yet. Some people are just bringing their teeth together and clenching down during the day. And then once you give them that heightened awareness of it, they just start cutting it down. And then before you know it, they notice during the day every time they clench. And something else I've told people to do is kind of like take your tongue and let it sink down and out in the sides of the mouth. So it's kind of between your teeth. And if you just let it rest there, every time you try to bite down, you feel it. And it's
Yeah.
a good way to start the
Oh, that's
habit.
a good idea. Yeah.
Yeah, and it actually works pretty well. And then the bigger question beyond that is nighttime, which
I
obviously
know.
like awareness is not going to help with that. So when it comes to nighttime, I always say like to try to impact nighttime clenching, it starts with what you do during the day. So all the typical deep sleep strategies of not eating before bed, not exercising before bed, getting off the devices before bed, a cool room temperature wise, even like reducing clutter, the right pillow, all of those things to help you decompress. If you have a stressful life, like meditating or taking breaks in the middle of the day instead of just like hammering your body and mind all day. And then at the end of the day saying, all right, now I'm going to relax for 20 minutes. Like, no, taking like micro naps or pauses throughout the day help a lot as well. Holding the right resting jaw posture, making sure that your teeth are, like I said, separated during the day, lips sealed. And if you don't have any airway issues, you should be able to breathe nasally throughout the day. And then we're stimulating the diaphragm, we're getting the vagus nerve involved. When people have true airway issues and they essentially have to mouth breathe or have to bring their head slightly forward to pull the air in, because when you try to bring them upright and nasal breathe, they just can only do it for
I
like
know.
30 seconds. That's why I also always assess sleep issues. I'll send someone for airway,
Good.
have them have a sleep
Wonderful.
study,
Yeah.
because at some point, if your anatomy and your tissue is just has developed in a manner that you can't get air in, everything's going to be a short-term fix until you address that.
Sure. Sure. Yeah. Totally. I agree. Like airway, forward head posture, TMD, neck pain, everything just goes hand in hand for many of
Right.
these patients. Yeah.
Do now? There's also a lot of research that shows that clenching is tied actually to airway. Like people who have more airway and breathing issues clench more, which I always
Yeah.
find very interesting.
Yeah.
Do you have any experience with that?
Oh, definitely, yeah, and, clenching and grinding, I would say.
Clenching,
So grinding the jaw forward actually opens the airway. So it's like our body's protective mechanism
right?
to to open the airway when we're struggling for oxygen at night. And so definitely, I mean, I would say the majority of my patients have some sort of sleep disordered breathing.
Hmm.
They're definitely clenchers, they're bruxers, and, I only treat TMD, so I see, like, the patients that are in the most pain, so,
Right,
take it with a grain of salt. I don't know how many of these patients are
right.
sitting around in regular
Always,
dental offices, right? But,
right.
from what I see, it's very, very it's all connected.
Mm, got it.
And is there a dentist that you work with in your area that makes orthotics? I've been wanting
So
to ask.
yeah, so I no, I work with a bunch of different dentists in the area. I don't have like one exclusive person that I work with.
Okay.
And so the problem that I see is that people don't want to get appliances anymore because they went to the wrong people,
I
like they got
know.
ripped off, and they're like, they'll be like, I just bought one for $2,000, it didn't fit, and then they didn't want to do any type of adjustment to it, so I just stopped doing that. I did that. I'm done with them. And I always tell people the number one thing you want to look for, besides obviously like a very capable dentist who specializes in the area, is someone who's willing to work with you and says, if there's an issue with this, you come back, we're going to tweak it, we're going to move things around, like we're going to make this work.
Oh,
Because I think a lot of people are fearful that it's going to be a one-time deal where it doesn't fit them well, and then the
I
dentist
know.
doesn't want to do anything else with it, and then it's a bigger investment too. So that's kind
I
of
know. I
and
know.
that's why
It's
I
like
think the education on this topic is so important, because I
but
know that it helps
yeah,
people, but people want to feel safe when they go through the process. That's just from my perspective to any dentist out there. Like I
yeah.
think if you can nail that education with them, and you're gonna get more people to actually be able to help themselves.
Well, also, it's like nailing the education with the dentist because as a dentist I didn't do any TMJ work for the first 11 years of my career.
Mm,
And then I learned everything, and now all I do is TMJ work. As
right,
a dentist that made night guards, regular old night guards for people with TMJ problems, because that's what I was taught to do,
right.
we were sort of taught to give it to them and say bye-bye. Like, we weren't taught how to adjust it, or so it may be a lack of confidence or knowing what to do on the dentist part
That's
too,
a good point.
and so, like, educating not only the public, but educating dentists is, like, so key, and so I'm actually holding courses. I have one in August this year, and I'm planning my next one for June of next year because I'm like, we've got to educate dentists about this. But I've limited it to 12 dentists because I can't teach the hands-on stuff to more than that. We do a
Yeah,
lot of hands-on.
yeah, that's great. A lot of the courses that I've taken, it's the smaller group is the way that you're really gonna.
It's how you learn better too. So
It's,
I'm excited for that. Do you do a lot of like intraoral massage, or do you not do that so
no,
much?
I do that. So what I've learned just with head, neck, and jaw in general, um, it the joint positioning is what really is going to get you the longer term impact. So I
Yeah.
will do manual releases and myofascial work, and it helps people to feel better, it calms down their nervous system. It allows the muscle to accept treatment better.
Sure.
So if you need to strengthen a muscle or activate it better, if you can actually get your hands on it to calm it down,
Yeah.
um, it puts it in a better state. But a lot of people get stuck in that cycle of just like massaging only. And then the muscle is typically the symptom. Like muscles fire and get painful and get irritated because they're over lengthened, over shortened, over compensating.
Yes.
And so being able to allow the TMJ to find a better aligned position where it can move more easily, making sure the muscles of the jaw can pull it into an aligned opening position. You can reduce any deviations or deflections if there's not a major joint issue there.
Yeah.
Like all of that is what gets people the longer term effect. The compensations of I have stiffness when I open my mouth, so now I tilt my head back to open my
Yeah.
mouth more, and I've been getting headaches now, and so I really the philosophy is reposition the joint early and as often as possible. And then from there, just rebalance the system, like making sure there's no compensations through the muscles. So
Yeah.
a lot of people, but I can teach a lot of people the manual. The great part about treating this area of the body is you can reach everything. So I can teach someone
Yeah.
how to get to pretty much any muscle. And
Nice.
so, and once I teach them that, I just have them do that on their own. And I work with so many people virtually, and it's just you have a good video explaining how to hit the muscles, and they can do it on their own. And then it's just about the education of the progressions to go through.
I love that. I love that. I'm sure you see people that would really benefit from a good orthotic, right? Made by someone who
Yeah.
knows what they're doing. So, but
Yeah.
yeah, I'm with you. Like, repositioning, getting that joint in the right position is so powerful, right? So,
Yeah.
um, I think, and it's interesting because with DTR, you think by adjusting the teeth, well, what are you doing for the joint? But what's interesting is that once the muscles relax enough after you've done the DTR, we
Mhm.
see the muscle firings go down. For many people, as the muscles relax, the jaw then drops down and forward, and
Mm.
suddenly they're biting a little more in the front.
Right, right, right. Yeah.
So then you balance it out slightly, and we get to a point where the joint is in a different position, the muscles are calm, and the bite fits well together. That is like the triad. That's what you want.
That's amazing. And yeah,
Yeah.
it's right. And so if you just went after the muscles, you might get it to actually settle into a position, then it'll probably come right back up again because you haven't addressed.
Address everything,
Yeah.
right? And so that's why many of my patients, they have to wear their nighttime orthotic forever. I mean, I see patients from my mentor from like 25 years ago, and they come in every like 3 years, 5 years, 7 years, whatever. Like, my dog ate my orthotic, I need a new one. Or like, I lost it on this trip, I need a new one. Like, they can't function without it
Right.
because we didn't fix the bite.
Right.
I'm happy to fix your bite, but people
Right.
don't necessarily want to spend 50 or $60,000 on that. They'd
Right.
rather just wear the orthotic forever at
Right.
night.
Yeah,
Right.
it's amazing how quickly that the teeth do reposition. I've had just an orthodontic appliance, and whenever if I would go on vacation and not bring with me, and a week would go by, and then I would start getting a space in my two front teeth.
Yep.
Like, I cannot believe how quickly things reposition
They
themselves.
do. It's amazing. It's
Yeah.
amazing.
Um, anything else about this?
Gosh.
Um, did
Um,
you miss any kind of thing you put in your mouth, for lack of a better term?
yeah. Well, oral appliances for sleep apnea. That's
Mm,
kind of an
yes,
interesting one.
true, true, true.
Yeah. So there's oral appliances that literally just crank your jaw forward to open up your airway when you're sleeping. So for people that can't tolerate a CPAP, they'll come to me and say, "Can you make me an oral appliance?" Now the tricky part is an oral appliance for sleep apnea is not the same as a TMJ orthotic.
Hmm.
They
Yeah.
are different,
Right.
right? They're not the same.
Yeah.
And so if a patient has moderate to severe TMJ problems, I cannot make them an oral appliance to treat sleep apnea because it's going to
Right.
make their TMJ worse. So I
Because
have to
that's going to
treat
shift them forward to get open the airway.
just so far forward that
Yeah.
it's just like this arbitrary forward that's not necessarily good for the muscles and
Right.
joints.
You're just doing that just to get air in,
Just
and
to get air in,
like
right? There's
by
no
any
like
means necessary.
right, right, by any means exactly. And so for some of my I always say we have to treat the TMJ first.
Hmm.
And then once your symptoms are stable, your joints are feeling good, your muscles are feeling good, I can build you an oral appliance for sleep apnea with the TMJ prescription built into it.
Mm.
And that's pretty like unique. That's something my mentor came up with. I don't know of any other dentists that are doing that out there. So
Mm.
I can't even take credit. I didn't come up with it. But like I think it's pretty neat that we can do that. And so yeah, there's so many different appliances. There's so much like lack of knowledge and information about them. There's retainers, there's
Yeah.
there's so many.
What about alternating? Like, let's say that you had, one appliance that was pretty good at making you not clench, but it was shifting your TMJ too far forward and it created irritation. And then you had, one that just protected your teeth but it didn't prevent your clenching. Like, what about doing like one night, one the other? So like, I don't know. So, because I always think the way I think of it sometimes is like, I have people who have a flat plane hard acrylic and
Yeah.
it protects their teeth and they're happy. Like, all right, my teeth, they're fine. But I clench on them. My muscles are killing me in the morning. And
Yeah.
then they say, I have one that it was an anterior deprogrammer. It just shifted me forward a little bit. So I hit the front 6 teeth. And for that one, I don't clench. My muscles are fine. But my dentist told me I shouldn't wear it too much because I shouldn't be shifted forward too much. And there's times when I'm like, can you alternate? I have no idea if that would be
I don't
a
know if you could alternate. I mean, I'm sure I would be willing to try it with someone if they wanted to, but
right.
in that case, I would just make them a really good orthotic.
Right.
Just to wear every night, then they don't even have to alternate.
To
It
kind of come
protects
back.
the teeth.
Okay.
It treats the muscles, it protects the teeth. I mean, in orthotics, people typically clench with less force because they
Mhm.
can't engage the muscles as much as they can in their natural bite. So that's what I would do, but I'm sure, I'm sure there's something to be said about
Alternating.
alternating. Yeah, I just haven't done it, so I don't know.
Another question, because I could ask a million questions, but I don't.
Yeah.
But when it comes to reducing clenching because the device is in there, what are the main factors that you find will reduce the clenching? Is it the thickness of it? Is it the way it positions the jaw?
I
Is
think
it
it's
the
the way it
different
positions.
tooth contact?
Yeah. I think it's the way it positions the jaw. It
Okay.
positions it in such a way that you can't clench as hard,
Hmm.
and it can reduce clenching, but it doesn't eliminate clenching like the way I've seen DTR do.
Got it.
Um, so I think that's the main thing. I think it's where it positions your jaw. But you'd be surprised people can still clench pretty hard in different positions. Like again, it's like in our central nervous systems.
Yeah. 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 Okay. That makes sense. All right. So we covered. Why don't you recap the types of devices that we covered?
Yeah, yeah. So we covered night guards, just regular old night guards, TMJ orthotics, and oral appliances to treat sleep apnea. And they're
Yeah.
all very different. We sort of touched on retainers, which just literally just hold your teeth in
Right.
a
Yeah.
certain alignment, right? So
That's just a pure cosmetic thing.
yeah, yeah, yeah. So yeah, that's sort of what we've touched upon. And I'm a big believer in orthotics made correctly, and that's the tricky part. It's like as a patient, how do you know? How do you
Right.
know who to trust? How do you know who cares and has your back and is willing to check in with you? I give a lot of my patients my cell number, and I'm
Mm.
like, I want to hear from you. Just text
Yeah.
me. Yeah, I'm like, yeah, and so they know I'm here for them. But like, um, it's a tough thing.
Yeah. No, absolutely. It's just one piece of the puzzle. I mean,
Yeah,
but as we know, it's a all-inclusive approach. And there's a lot of people who have jaw pain and it's not even a TMJ issue. It's referring from some other nerves on the head or neck. It's like we were saying before, it hasn't gotten to the point where it's purely a myofascial muscular problem. And I think that's the bit, like whenever I look at someone, I'm always looking at the buckets that they could be placed in. Like, is it referred from a different part of the
I know.
body, like the neck? Is it is there joint degrading or a disc displacement issue? Is it just a muscular or fascial issue? This is all going to determine how you treat the patient.
Yeah. Oh, definitely. And there are some people where their joints are like perfect, right? And it's all muscle.
Right,
It's
right.
all muscle, right? So and then there's some people where it's a combination. So yeah, and knowing how to diagnose that will make it so what treatments are
Hmm.
appropriate.
Yeah, absolutely. Okay, so I gotta think on what we should talk about next time.
Huh. We could do DTR, but we could also do like more of what you do
Hmm.
because I'm curious about that. So um we could talk more about how you treat your TMJ
Yeah,
patients because I
yeah, we
feel like
could
I've
do
just
it.
been talking about myself this whole time.
Yeah, this one's been more for you.
Yeah,
This
let's
was
do
nice.
one for you.
Yeah, I've just been able to ask the questions. You've been on the hot seat. So we could flip that around next time. Okay, cool. This was great.
Yeah, this was really good. This was
Yeah.
really, really. Can we see how many people joined us? I can't see any
So
numbers
right
here.
now there's 50 people right now.
Mm,
There will be a recap after.
sure.
So this is the first time we're using this platform. So right
Yay!
now we're on Facebook. I'm on LinkedIn. I don't think you are, and then but we're both on YouTube.
That's
So
so cool.
and this will be a recording also. So in case any of the
Yeah,
platforms did glitch, because I got to check that. In case it didn't stream somewhere, there'll be a recording. We could post it as a reel.
this is so cool. I love this
Yeah,
platform.
yeah. This is
Cool.
all right. Well, listen, it was nice. We did about a half hour. And we'll do this again.
We'll do it again. Thanks,
Okay.
Joe.
All right. Thanks for setting this up.
Yeah, bye.
All right. Bye bye.